Plantar fasciitis is a common and often painful foot condition characterized by inflammation of the plantar fascia, a thick band of tissue that runs along the bottom of the foot, connecting the heel bone to the toes. Here's a detailed description of plantar fasciitis. 1. Causes. Plantar fasciitis is typically caused by repetitive strain and overuse of the plantar fascia, resulting in microtears and inflammation. This condition is commonly associated with activities that involve prolonged standing, walking, running, or jumping, as well as factors such as obesity, improper footwear, high arches, flat feet, and tight calf muscles. 2. Symptoms. The hallmark symptom of plantar fasciitis is heel pain, particularly upon waking in the morning or after periods of rest. The pain is often described as sharp, stabbing, or burning, and may gradually improve with activity as the fascia stretches, only to worsen again after prolonged weight-bearing. Pain may also be experienced along the arch of the foot or at the insertion point of the plantar fascia on the heel bone. 3. Diagnosis. Plantar fasciitis is typically diagnosed based on clinical history and physical examination. A healthcare provider may perform tests such as palpation of the affected area, gait analysis, and range of motion assessment to confirm the diagnosis and rule out other possible causes of heel pain, such as stress fractures, tendinitis, or nerve entrapment. 4. Treatment. Treatment for plantar fasciitis typically involves a combination of conservative measures aimed at reducing pain, inflammation, and stress on the plantar fascia. This may include rest, ice therapy, stretching exercises, orthotic devices, supportive footwear, and nonsteroidal anti-inflammatory drugs, NSAIDs, to alleviate pain and swelling. Physical therapy, corticosteroid injections, shockwave therapy, and extracorporeal pulse activation therapy, EPAT, may be recommended for persistent symptoms. 5. Prevention. Preventing plantar fasciitis involves adopting healthy foot care practices and lifestyle habits to reduce the risk of overuse and injury. This includes wearing supportive footwear with adequate arch support and cushioning, maintaining a healthy body weight, gradually increasing the intensity and duration of physical activity, incorporating regular stretching and strengthening exercises for the feet and lower limbs, and avoiding activities that exacerbate symptoms. 6. Prognosis. With proper treatment and self-care measures, most cases of plantar fasciitis improve within several months. However, recovery times may vary depending on the severity of symptoms, underlying contributing factors, and adherence to treatment recommendations. In rare cases, chronic plantar fasciitis may require more aggressive interventions, such as surgery, to alleviate pain and restore function. Overall, plantar fasciitis is a common foot condition characterized by heel pain and inflammation that can significantly impact daily activities and quality of life. By understanding the causes, symptoms, and treatment options for plantar fasciitis, individuals can take proactive steps to manage their symptoms effectively and prevent recurrence.